Hello, I'm Maura Carley, founder and president of Healthcare Navigation, and today we are going to start a discussion about Medicare supplements, also called Medigap plans. I say begin a discussion because we'll have a second video about Medicare supplements. There's a lot to cover. So first, what are they? We've talked about Medicare Part A, B, C, Advantage plans, and D. Medicare supplements belong in that discussion, but they are not a government benefit. They are private products that you buy directly from an insurance company, and the reason they exist is to help provide additional coverage when you have out-of-pocket expense associated with Part A deductibles, for example, or co-payments, and of course Part B co-insurance. So it's an additional source of coverage. Who should have a Medicare supplement? In our opinion, everybody on Original Medicare should have one. We're going to discuss the various options in the next video because in most states there are many, and unfortunately whoever devised this system labeled them with letters. And I can't even tell you how many times people have told me when I'm starting to discuss supplements with them that they already have A and B. And there are Medicare A and B supplements and many more in most states, but they are different than Medicare Part A and Medicare Part B. You'd need both A and B active to enroll in a Medicare supplement. But the primary reason to have them is for this additional source of protection. They also have two other benefits that don't just supplement when Original Medicare A or B pays. They are additional benefits. So every supplement has an extra 365 days of hospital coverage. And you'll recall, if you watched our Part A video, and if you didn't, go back and watch it, that when you're on Medicare, you can never have more than 150 days of hospital coverage at a single time. And so you get catastrophic hospitalization through a supplement or an Advantage plan. The other additional benefit that some supplements have is the foreign travel emergency, which is a lifetime maximum of $50,000. We don't believe that's enough, and we will talk about that in another video. But just know that those are additional benefits. Everything else pays in conjunction with either Medicare A or B. Supplements have nothing to do with D. They existed well before Part D existed. So if you have a service that isn't going to be covered by Part A or Part B, like a physician who's opted out of Medicare, which means that physician has no relationship to Medicare, then the supplement is not going to pay in that circumstance. So supplement and Medigap plans, those are apt names for how they generally work. So let's talk about how they're structured. 47 states use a standardized approach that was standardized at the federal level. These are unusual products because they're also regulated by state insurance departments, and the states vary. But 47 states use the same system. Somewhere along the line, Massachusetts, Wisconsin, and Minnesota got permission to do something else. And frankly, I like the approach of Massachusetts and Minnesota, which provide fewer choices with, I think, no harm at all. But anyway, what the feds did is if you buy a Plan G, for example, and that is the richest plan you can buy now. Your benefits are the same whether or not you buy that in any of the 47 states, so New York or California or wherever. The states regulate other parameters, how the premiums are developed, what premiums are charged, can there be a tobacco surcharge, which carriers are going to sell them. So the states regulate other parameters, and you'll actually find information on supplements typically on your state insurance department website. So, honestly, I think we can wrap up the discussion of supplements to say these are important products. You've got to make a very sound decision about which one you buy. And, another way to think of them is this gives you an out-of-pocket maximum, which would be derived by the premium for your supplement and what the deductible level and other exposure is. But remember, Medicare doesn't have an out-of-pocket maximum like individual and group coverage does. So watch for our next video. It will have more information about Medicare supplements, and thank you for listening. Take care. Bye-bye.